Hello everyone, welcome to the FRAS Focus Regional Anesthesia series. I am Dr. Gopal Kishan Jalwal. In this video, I will demonstrate you how you can perform the clavicle surgeries under the sole regional anesthesia technique. So for the clavicle surgery, we have to perform the two block, interscalene brachial plexus block and the intermediate cervical plexus block. So for these blocks, patients should be placed in a supine position and we use the high frequency linear probe. So for the local anesthetic, we commonly use bupivacaine, levobupivacaine and ropin. In the interscalene block, we use the 10 ml, and for the intermediate cervical plexus, we use the 10 ml. So usually in the interscalene brachial plexus we target the roots, and in the intermediate cervical plexus we target the cervical plexus. So when you place your probes at the middle of the neck at the C6 level, just little to the sternocleidomastoid, you will see this image, and here you can see the anterior muscle, middle scalene muscles, and in between these two muscles you can identify the C5 and C6 roots. So you have to deposit the local anesthetic around these roots to perform the interscalene brachial plexus block. So here you can see my needle is approaching between the C5 and C6. So now I am going to inject the local anesthetic. First I will give the local anesthetic on the lateral side of the roots, here you can see, and then I will go on the medial side between the C5 and C6, and then I will inject the local anesthetic on the medial side of the roots. So here I will inject the 10 ml local anesthetic. So when you place your high frequency linear probe at middle of the neck at the C6 level, just lateral to the lateral head of the sternocleidomastoid, then you can see the tapering of the sternocleidomastoid just above the anterior scalene muscles. So we have to deposit the local anesthetic just below the sternocleidomastoid for the intermediate cervical plexus block. So here you can see my needle is approaching just below the sternocleidomastoid, and in that plane, so I will deposit the local anesthetic 10 ml, and here you can see I have deposited the local anesthetic just below the sternocleidomastoid to perform the intermediate cervical plexus block. And after performing the block, you can see that we have not given any sedation, and patient is very comfortable, and surgeons are operating on the clavicle. So this patient has the lateral 1/3 of the fracture of the clavicle,